Software installation. Open your browser and go to www.igloo.today. Select Download in the main menu. Download the appropriate DXCare version for your operating system. The app is available for Windows, Mac, Android and iOS. Double-click on the downloaded file to start the installation. A warning about an unknown application may appear. Click on More Information and select Run Anyway. The installation will now run. Finally, click Finish, and if the checkbox is activated, DXCare will run immediately. Connect your Igloo to your PC using a USB cable, and you can open the settings via the Devices menu item. Here you can make various customizations or update the firmware. Material: Igloo reader, test-specific adapter, test cartridge. Please note expiration date. Safety lancet, buffer solution, pipette, alcohol pad, swab. Additional note: the scope of the consumables supplied depends on the test kit. Preparation: ensure all materials are at room temperature. The patient should wash hands and dry them thoroughly. The patient's hand should be warm to facilitate blood extraction. Lay out all the materials you need on a clean, flat work surface. Remove the test cartridge from the foil pouch just before performing the test. Follow the test instructions for the amount of blood to be drawn and other instructions for performing the respective test. The first test, made of each batch number or new parameter, requires internet connection and should be performed with smartphone or PC setup. Following tests can be performed offline once the device has obtained the test metadata. Blood collection. The best places to draw blood are slightly to the side of the ring finger or middle finger. Gently massaging the finger before the puncture helps. Disinfect fingertip with alcohol pad and allow to dry completely. Prick the finger with the lancet and wipe away the first drop of blood. If necessary, gently massage the finger again. Too much pressure will contaminate the sample with tissue fluid and affect the result. Touch the surface of the blood drop with the pipette, and the blood sample will be collected. Stop blood flow with swab. Tests require different amounts of blood and are supplied with different pipettes. Please refer to the user guide for the respective test. Mix the blood sample thoroughly with the buffer solution until the mixture has a uniform colour. Add the correct amount of sample mixture to the sample well of the test cartridge, according to the test instructions. Test evaluation. Insert test cartridge into the corresponding adapter. Switch on the Igloo. Select Start Measurement and enter a test ID. Further info is not mandatory. Set the timer switch to on if you want the Igloo to use the internal timer for the incubation time. Alternatively, you can use an external timer. Select Next to start the measurement. Insert the adapter with the test cassette into the device slot, ensuring that it is oriented correctly. Caution: for test cassettes with a QR code at the top, only insert the test cassette far enough so that the code disappears into the device. Once the camera has read the test data, the LED ring will flash green after a few seconds, and the adapter can be inserted completely. A corresponding message also appears on the display. Do not move the reader while a test cassette is inside it. When the reader is connected to a smartphone, Bluetooth, or PC, USB cable, the result is displayed on the respective device. The result can be shared directly from the reader by scanning the QR code on the display. Or be printed with the optional thermal printer. Test evaluation with smartphone. Switch on the Igloo. Start DX365 Care app on your smartphone. You can download the app from Igloo homepage, www.igloo.today/downloads. Press the blue plus button in the lower right corner and select the device if it is not already connected. Confirm Bluetooth connection. The new measurement screen will open. Enter a patient ID and add additional data if necessary. Set the timer switch to on if you want the Igloo to use the internal timer for the incubation time. Alternatively, you can use an external timer. Select Next to start the measurement. Insert the adapter with the test cassette into the device slot, ensuring that it is aligned correctly. Note: test cassettes with a barcode on the side can be inserted all the way in. For test cassettes with a QR code on the top, the device has to read the code first. To do this, only insert the test cassette far enough so that the code disappears into the device. If the LED ring flashes green after a few seconds, the adapter can be inserted all the way in. If the internal timer is set, the reader automatically reads the test after the incubation period has elapsed. If the timer is switched off and you have allowed the incubation period to elapse outside the reader, the measurement starts immediately. The result is displayed on the smartphone and can be exported or shared via QR code. Test evaluation with PC. Launch the DX Care app on your computer, connect it to your Igloo, and turn on the reader. In the new measurement screen, enter a patient ID and any other information as needed. If you want to use the Igloo's internal timer, leave the measurement timer function switched on. The Igloo will automatically run the correct incubation time for the test. Click Next and insert the test cassette into the reader. The process will start and cannot be interrupted. Once the test has been evaluated, the result is displayed. Using the Export function, you can now export the result in various formats. Save it, or start the next test evaluation by clicking the New Measurement button. After use. Remove the adapter and dispose of the used test cassette in accordance with local regulations. Turn off the Igloo. If you do not continue to use the reader, it will turn itself off after a few minutes of inactivity.